here is that very low fraction, about 1%, but we're talking 1% out of 25 million plus human population. So we're talking about thousands of patients out there that are potential volunteer donors who have this particular mutation. And if the transplant is performed with the help of those donors, and the patients get the whole new immune system that can now not only fight and cure their underlying cancer, the blood cancer, but it can also render those patients resistant to HIV. So that's the whole concept, and certainly the success of these two reports that have been out there. The first was about a decade ago that came from Berlin, and it's a famous Berlin patient that did receive so-called allogeneic stem cell transplant when other donor is used for the stem cell source to cure that patient. And then the second case came just recently. No, in general, it's certainly not rare to find a match for patients with blood cancers. In fact, most of the patients, do find suitable donors these days. And as I said before, some of those are coming from unrelated donor registry. There are over 25 million donors potentially available there. So it's not rare to find the match for patients with blood cancers. However, it is relatively rare to find a match that would carry this particular mutation that can potentially render HIV positive patients resistant to HIV. Because once again, it's 1% out of all the donors out there. Yeah, but out of all potential blood donors, 1% only can potentially have resistance to HIV virus of the general population. So to do the rough math, if we've got over 25 million unrelated donors potentially available to cure patients with blood cancers, then 1% of those, and we're talking with a rough mathematical calculation, we're talking about thousands and thousands of patients out there that can potentially be suitable to also render the patients resistant to HIV. Now, this percentage differs by the ethnicity. And this particular HIV-resistant mutation is more enriched in Caucasians. But interestingly so, Caucasians also account for the majority of potential matched unrelated donors in most of the registries around the world. Would that answer the question? Right. That combination is certainly rare. Even though leukemia is not the only indication for the stem cell transplant, a lot of patients do receive transplant for the conditions called lymphomas. And we know that the incidence of lymphomas increases among the patients who are HIV infected. In fact, the second case that achieved so far a cure from his HIV and lymphoma was a patient with Hodgkin lymphoma. It's a type of the lymphoma called Hodgkin's disease. And those type of lymphomas are enriched and happen with higher frequency among patients who are HIV positive. I'm sorry, say it again. I didn't hear your question. I apologize. Yeah, that's a very good question, whether the HIV positive patients without blood cancers or without potential benefit from stem cell transplantation for the cancer indication, whether they would benefit from bone marrow transplant. So unfortunately, as of today, bone marrow transplant has not been and will probably not remain an indication for patients who are just HIV positive. And there are certain reasons for that. First and foremost, HIV has become a very successfully treated disease in a way. And from highly fatal disease, it has become almost a chronic disease that patient can live for years and die from different reasons other than HIV because of very potent therapies that we've got. And those are basically oral medications and pills that most of the patients are taking, and their HIV is well controlled. At the same time, with the stem cell transplant, there are some serious life-threatening complications that can happen just as a part of the transplant process. So in terms of the risk and benefit, as of today, it wouldn't be indicative for just HIV-positive patients without blood cancers to undergo this type of rigorous therapy with the blood and marrow transplant, because the risks might be higher compared to daily pills that most of the patients take and tolerate well. However, for the patients who have concurrent blood malignancy or any other indication that they might be treated and be a good candidate for stem cell transplant, this type of strategy can certainly kill two birds with one shot. Not only it can potentially cure their underlying blood cancer, but it can also, as we could have seen from these last two cases reported, lead to potential cure of their underlying HIV infection. Of course, yeah, that's a very sort of remarkable observation, but it's got very interesting biology in the story behind. If you mind, I'll probably try to outline it in just a couple of words. So this particular mutation that I mentioned that might render patients resistant to HIV has been really around for about 2,000 to 3,000 years, and it's been particularly enriched in Scandinavians. And there are some hypotheses out there why this mutation even occurred in human population. And it seems that this mutation could have been developed as a biologic pressure from major plagues and conditions that the human population was experiencing about 2,000 to 3,000 years ago. And two major conditions that are under suspect are bubonic plague and smallpox. And apparently we know from some animal experiments that if you completely knock out this particular marker, this mutation, CCR5, those subjects are more susceptible towards infections. So it seems that evolutionarily, the human population was developing this particular mutation in a way of resisting, those major infections. So the spread of this genetic makeup has been largely facilitated by Vikings. And in fact, if you look at the prevalence of this mutation, it goes down from North Scandinavian area all the way to the North Africa and West Asia, where this mutation has been found. It's not been found in any other human population around the globe. So it's kind of got very interesting story. But basically, this is the evolutionary way of developing some kind of mutation that can render humans more resistant towards certain infections. And HIV is just another example. Well, certainly, as I mentioned, the patients with Scandinavian background can have a quite high prevalence of this particular mutation. And once again, when we talk about this mutation, we're talking about elimination of two alleles. We each get two genes from mother and father. And so when we're talking about this mutation, we're talking about the one that has elimination or this delta 32 mutation present in both of our chromosomes. And that's the one that's fairly rare. The presence of this mutation only in one is certainly much more prevalent. But that wouldn't render somebody completely resistant to HIV. You really need to have those two chromosomes with specific mutation and deletion. And that's why the prevalence of that is around 1% across the globe. Yeah, certainly. We've got genetic tests available. And in fact, we get sometimes HIV patients as well, who we want to take through stem cell transplantation to cure their blood cancers. And the first question that we usually ask and pose towards this big donor registries is there any way we can also check for this particular mutation? Because certainly it's very attractive target to cure two major diseases with one type of procedure, which is stem cell transplant. Well, it should be pretty straightforward. So it's basically a type of the gene polymorphism or gene difference that can readily be done, with available techniques. So it's not a complicated type of test. Yeah, some of these experiments certainly have been done in macaques and in monkeys. So there's some pre-existing story to this, certainly. But now we've got two cases that have been demonstrating sustained undetectable viral loads for HIV virus for quite some time. For the second report that just came out, we're talking about 18 months of finding undetectable viral loads, as opposed to the time when this patient was taking antiviral medications. And certainly the first case that has been going on now for over 10 years with no evidence of HIV recurrence. So we certainly know that HIV has the mechanism that it needs to infect these immune cells, these T lymphocytes. And when this mutation is present, that process is impaired and HIV cannot get into the cell. Well, I guess these two reports certainly open a very attractive opportunity for patients with HIV with concurrent cancers that have an indication for the bone marrow transplant. Once again, just as a summary, and we've discussed this extensively. But I think we cannot truly say that bone marrow transplant is a solution for the patients who have just HIV alone, because most of those patients are doing very well with existing therapies. Most of those are pills that the patients take regularly, and their HIV is well controlled. But certainly for somebody with concurrent blood cancer, this might be an attractive and potentially curative option for both medical conditions, HIV infection and blood cancer. Well, thank you for your time. Really appreciate it. Take care.